The FIRE-6 trial basically was a single-arm phase 2 trial investigating FOLFIRI plus Cetuximab, followed by FOLFIRI plus Cetuximab in combination with Avelumab, a PD-L1 inhibitor, and then after another 4 cycles, this was switched to a Avelumab PD-L1 inhibitor maintenance treatment. And the rationale was basically, as Cetuximab, being an IgG1 antibody, is doing some ADCC, so antibody-derived cytotoxicity, is it possible to actually boost this antibody-derived cytotoxicity by adding a PD-L1 inhibitor? So a total of 60 patients were treated within this trial, and the ATP population, the according to protocol population, consisted of 53 patients. So after an induction treatment of 4 cycles or 2 months of FOLFIRI Cetuximab in RAS wild-type patients, Avelumab was added for another 4 cycles, and then the maintenance was measured, and with a PFS of just 6 months, it became clear that the maintenance with Avelumab is not successful in this setting. So basically it's a negative trial. We were aiming towards a PFS of 8 to 13, almost 13 months. We got a PFS of just 6 months, so that's not the way we should go. The overall survival with a follow-up time of 12.7 months is still too short to really make any kind of conclusions out of it.